cardiovascular pathology, hypertension. All right, so for hypertension, the first thing that we need to understand is just the definition. If you see a blood pressure of systole over diastole of 130 over 80, anything greater than that, you're going to be considered to have hypertension, okay? And there's different forms of hypertension. The first one is hypertensive urgency, and that's just severe hypertension. So if we have 180 over 120, anything greater than that number is going to be hypertensive urgency, but there's no acute end organ damage, okay? And then hypertensive emergency has that 180 over 120, so severe hypertension once again, but there is evidence of acute end organ damage. Okay, so those are the differences. I never knew and I never understood the differences. If you see high blood pressure, any patient that's hypertensive, and they have evidence of end organ damage that might look like renal failure, something like that. And we'll talk about that end organ damage shortly. But if you see that, that's just the definition of hypertensive emergency. Okay, they like to ask about that. And another word for that would be malignant hypertension. It's the same thing. They use it interchangeably. All right, so that just means that there's evidence of end organ damage with hypertension, severe hypertension. All right, now hypertensive emergency can progress into acute end organ damage, and we're going to see the main type is going to be kidney damage. Okay, so we have to look out for something that affects the kidneys. Okay, and what we're going to be seeing specifically in the kidneys is hyperplastic arteriolosclerosis. Okay. And that is a form of, damage to the blood vessels of the kidneys due to or secondary to hypertensive emergency. And we'll get there later on, but I just want you to make sure that you understand that. And what we'll see normally is onion skinning. That's what they'll say. They'll say onion skinning. Hyperplastic arteriolosclerosis is also known as onion skinning in the kidneys vasculature. Okay. Secondly, you can likely see arterioles that have fibrinoid necrosis. And we already talked about fibrinoid necrosis in the pathology chapter, but understanding it is that since you have so much pressure on those blood vessels, they start to necrose and they start to die off in large amounts, okay? And we know that when blood vessels start to have necrosis, the form of necrosis that they undergo is fibrinoid, okay? So just keep a heads up for that. Now next, for all hypertension, the number one risk factor is increase in age. Okay, if you are someone that's older, you have an increased risk of having hypertension. And the reason behind it is that we have collagen that deposits within our blood vessels as we age. And because we have collagen depositing mainly in the aorta is what I care about most, right, which is a very elastic blood vessel. If I have collagen that's depositing in those elastic blood vessels, it leads to a decrease in compliance and it becomes more stiff. So you get a stiffening of the aorta. And so when we have blood that flows through, it no longer is able to accommodate the pressure as well as it used to be able to. Okay, so that collagen deposition within those elastic arteries is what causes that increased risk factor for increased age, all right, for hypertension. Now, there's other things like high sodium diet, obesity, diabetes, and things like that. But for right now, I want you to know that increase in age is very important. And they love to ask the number one risk factors on boards for different types of pathology, and this is one of them that they like to ask. So the question is, how does hypertension occur? So majority of the hypertension occurs is just primary, okay? So it's related to increased cardiac output or increase in total peripheral resistance, okay, of the blood vessels. Now, a little less, so it's about 90 to 10%. 10% is usually secondary now to renal or renovascular diseases, okay? And the reason behind that is that we know, and we'll talk about it a little more in depth when we talk about the renal section, but the kidney controls some aspects of our blood pressure, okay? Because when the kidney's not being perfused well enough, what happens is that it senses decreased perfusion because it's not getting enough blood, and so it'll activate the RAS system in order to increase the amount of fluid that we're retaining. So we're not really peeing out all this fluid, we're retaining it so that we can increase our blood pressure, okay? And so there are some pathologies that can cause hypertension secondary due to renal issues, okay? And one of the pathologies that they love to ask about is fibromuscular dysplasia. Okay, and fibromuscular dysplasia is just going to be kind of just this kinking of our renal artery. So multiple areas on the renal artery are kinked, which leads to decrease in renal blood flow. And so since the kidneys are sensing decreased perfusion, it's going to activate its RAS system. It's going to increase the amount of fluid that's going to be retained in the body and in the blood. And we're going to have an increase in blood pressure leading to hypertension. Okay. Now, the main characteristics. So what do patients present with fibromuscular dysplasia? The people that come in are going to be young females. So if you see a young female that has hypertension and then they go and they do an imaging scan and they see string of beads appearance of the renal artery or beading of the renal artery, then you know that you're dealing with fibromuscular dysplasia. Okay. So younger female adults. Now, the second thing that we can see that's secondary to renovascular diseases that causes hypertension is atherosclerotic renal artery stenosis. So renal artery stenosis due to atherosclerosis, okay? And atherosclerosis, which we'll talk about shortly in the next chapter, is just the buildup of this plaque and cholesterol in the blood vessels, okay? And it's usually due to smoking. It's also due to aging, right? Or eating fatty foods. So that atherosclerosis causes a blockage within the renal artery, same mechanism of action, right? So we have a blockage in the renal artery, okay, that causes stenosis. And so once again, that kidney senses decreased blood. So since it senses that decreased perfusion, what's going to happen is that it's going to cause the RAS system to be activated, and it's going to increase blood pressure leading to hypertension, okay? Now, the two differences here. Atherosclerotic renal artery stenosis is due to atherosclerosis. So the patient population is going to be older men who smoke. Okay? So older men who smoke with have renal artery stenosis and have hypertension secondary to that renal artery stenosis. Okay? Now younger females who don't smoke and they see a string of bead appearance have fibromuscular dysplasia.